I just crossed to the other side. Oh, they must be violent. Oh, it's something massive and you shouldn't be near them. Different ideas that people have about mental disorders. Today's World Mental Health Day. We're having this conversation for the next hour. We'll be visiting Port Harcourt and also going over to Kano to speak with our guests right there. So quickly head over to Facebook and YouTube where you can watch us live right now and you can join the conversation with us and with our guests both here in the studio in Kano and in Port Harcourt. You're welcome to the show today. I am Wemimo Adewuni.
And I am Sheriff Quadry. World Mental Health Day. These are some of those days that I would rather we have like 5 hours to talk about it. Because no matter how much the number of minutes that count, it will be like we can't do justice to this topic. So it's going to be an interesting conversation. You can watch us live on Facebook and drop your comments there. All those platforms are for you to engage with us. WhatsApp line is 0809 597 5805. That is 0809 597 5805. So it is the World Mental Health Day today. World Mental Health Day is observed on the 10th of October every year with overall objective of raising awareness of mental health issues around the world and mobilizing effort to support of mental health. Now, every 40 seconds, someone loses their life to suicide. This is according to WHO. It is not my thought. It is not our thought. This is a confirmed data from the WHO. However, this year's World Mental Health Day focuses on suicide prevention. The WHO's 2018 Global Health Observatory data repository records an estimated 17 suicides per 100,000 people across Nigeria, ranking 7th in Africa, just behind Zimbabwe with 19 suicides per 100,000 people. However, this year's World Mental Health Day is supported by WHO and International Association for Suicide Prevention and United for Global Mental Health. It is important. Mental health is an integral part of health and well-being, as reflected in the definition of health in the Constitution of the World Health Organization. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. That's how delicate health is. Mental health, like other aspects of health, can be impacted by a range of socio-economic factors that need to be addressed through comprehensive strategies for promotion, prevention, treatment, and recovery in a whole of government approach.
All right, we have joining us on the studio this morning Aladejare Samuel, who's the General Secretary, Resident Doctors Association at the Federal Neuropsychiatric Hospital here in Yaba, in Lagos. You're welcome to the show. All right. He's joining us live here. And we also have on the line all the way from Port Harcourt, Dr. Ruth Nyebuchi Phillips, Senior Registrar, Department.
I think we're going to Kano first.
Oh, we are?
Yes, we are.
Okay. Dr. Aminu Shehu Ibrahim, Mental Health Specialist, Department of Psychiatry at the Aminu Kano Teaching Hospital is joining us from Kano. And if you're on Facebook, you can watch us right now. Dr. Aminu, good morning.
Good morning.
All right. Thank you so much for joining us. Remember that you can watch us live on Facebook right now. You can also watch Dr. Aminu Shehu Ibrahim, who's joining us on the show. The federal government said about last year that 30% of Nigerians suffer from mental disorders. I'm starting with you, Dr. Aminu. 30% of Nigerians. That would mean 3 out of every 10 Nigerian has a mental disorder. Should we be scared?
There's no reason to get scared. I believe mental illness, just like all type of disease conditions or disorders, are very common throughout the world. You see, according to the figures from the World Health Organization, 1 out of every 4 people in the world will experience mental illness during his lifetime. So mental illness is not something that is quite rare. Anyway, mental illness is just a problem with the brain. Like you have other parts of the body having problems and you develop in a disease condition. So does the human brain also can have problem and somebody might end up with a mental illness. So it's not something that's surprising, such a figure. Besides, it's even lower than what we have in the world.
You said that at least during your lifetime, there's a point where you might experience one form of mental disorder. What causes these disorders?
Well, you see, there are so many reasons that somebody can have a problem, but the defense is an individual thing. And looking at them in a general perspectives, you can look at them from starting with the biological cause means something might happen to your brain in terms of having an injury, a road traffic accident, by accident of birth. Somebody might have problem during a woman giving birth. A child might have problem that will affect his brain, and later he might have a problem leading to mental illness. And it can also be to drugs, taking illicit drugs, and even the licit drugs like alcohol can irreversibly sometimes damage somebody's brain and lead to mental illness. And anyway, people might also inherit mental illness, inheritable, just like other disease conditions. But it does not mean that because somebody's father or mother or grandfather has a mental illness that he has to develop that. There is a lot of individual constitutional factors involved in that. And also it can be due to somebody's psychological buildup. I mean, people might be predisposed because of their own personality types to develop certain mental disorders compared to others. And there are a lot of what everybody knows, the social problems around us, the social situation, the social circumstances relating to the economy, the way people live, the way they interact with each other. But it might substantially, and all the stresses around us, because we cannot avoid stress. So some people might succumb to stress and come down with a mental illness. The bottom line with it is, unlike other disease conditions, nobody knows who is going to have this problem. There are some people who have risk factors. I mean, their family, they might be taking drugs, they might have an injury to their brain. But nobody has complete immunity. It can be any one of us at any time, in any place. Yeah.
Facebook, you could actually see Dr. Aminu Shehu Ibrahim, mental health specialist, Department of Psychiatry, Aminu Kano Teaching Hospital, live on our Facebook page. So if you're not on our Facebook page, feel free to go there and join the conversation there. Drop your comments and questions for our doctors on the show this morning. Let me come to Alade Jari Samuel, the General Secretary, Resident Doctors Association, the Federal Neuropsychiatric Hospital, Yaba, here in Lagos. And I want to ask you this question as a medical practitioner. What are the signs that we should watch out for, that people should watch out for in terms of, mental disorders?
Thank you very much. The signs to watch out for in terms of mental disorders, the major thing that anyone should be concerned about are changes.
Okay.
There are changes, sudden changes in behavioral patterns. So there are people who have been used to have certain behaviors that other people around them might consider maybe not mainstream, but that has been their normal over time. So you wouldn't conclude that such people have a mental illness just because they are not behaving the same way most people around them, or they don't have the same beliefs as people around them. But the major issue is there are sudden changes. For instance, let's assume somebody who is someone who is very quiet, somebody who is who keeps to self, who is very gentle, who could be very shy, suddenly starts maybe who can't even preach to somebody next to him, suddenly goes to the market and starts preaching to people, and maybe starts saying all the neighbors, telling them that you must be born again. So that kind of person whom you know that no, this person wouldn't have done this kind of thing, or maybe even in a ceremony, maybe even in an event, the person is the type that would just keep to self and wouldn't want to interact too much with people, and all of a sudden the person is all high and is greeting everybody, is introducing himself.
And there will be family members thinking that he just gained his confidence.
Just excited.
Not exactly. So when we see sudden changes, also there could be the opposite of it. Maybe somebody who is very outgoing could suddenly start keeping to himself, stay indoors, prefer not to talk to anybody. So when you see those sudden changes, you should be concerned. Those are the major areas of concern for anybody. Also for children, for instance, you could find them behaving in ways that are different from maybe suddenly they are irritable. Maybe a very respectful child suddenly starts looking his parents in the face and telling them things that he or she wouldn't have said in the past. So when you start seeing those sudden changes, you should be bothered that there might be a mental illness. And then there are the obvious ones that when things really get out of hand and everybody knows that something is wrong, the person starts talking out of point, the person starts saying things that are not there, starts hearing voices that are not there, and all the rest of which we all know at that point, that's when people rush down.
Right, right.
That's just the obvious one. Let's talk about the types of mental disorders, bringing this down home. What are the types?
All right, thank you very much. So, for the types of mental disorders, first of all, we could talk about the child. There are those that affect child and adolescents.
Children, what age?
Children from whatever age.
Wow.
There are developmental disorders,
Okay.
which the doctor in Kano mentioned that due to birth defects, developmental disorders due to birth defect, due to genetics. So they start showing up early in life, very early in life, and then much later you could start having the more popular ones like substance use disorders, which has to do with alcohol use, cocaine, cannabis, and then there are those that affect old age. The old age group of disorders, that's the dementias and the rest of them. Then also you have the psychotic disorders, where you have schizophrenia, which is the popular one that most people know and interpret as mental disorders.
Right.
And then there are the mood disorders, where you have depression, mania. Depression, everyone knows that, and then mania, which is the opposite of depression. And then you have anxiety disorders, which actually are the majority, because most people wouldn't come for help on time, and they are not too obvious to many people.
Right.
People don't realize them. They are actually the majority of the mental health disorders. So when they say 1 in 4 people will develop a mental health disorder, it's not exactly that most of them will develop psychotic disorders. Most of them will actually develop more of these anxiety disorders.
Okay.
If we have 50% of Nigerians absolutely poor, when we had this conversation on Chit Chat today, most of the comments were coming from, I don't have a job, things are hard, I feel depressed, I feel so sad, I don't know what to do. Some of them, information that's even available, they can't find it because they're just in a place where everything is just dark. So we have a lot of Nigerians currently going through these kind of problems. But we have right now 200 psychiatric doctors. So the last time we had Dr. Kike here, we were jokingly saying that we might need to laminate psychiatric doctors and put them in a museum because they're very
so golden
special
and rare.
and golden. Dr. Aminu, why do you think, I need to be sure if this is a problem from our educational system, that young people are not interested in studying these courses, and so we're not having enough doctors? If we have just 200 psychiatric doctors across Nigeria for a population of over 200 million.
Well, actually, I think it's a failure of the educational system in Nigeria. It's not only in psychiatry. Even in other branches of medicine, there's a gross deficiency in the number of doctors. If you look at the ratio of doctors to the total population of Nigeria, it's grossly deficient. Don't be surprised that countries like the UK, they are still looking for doctors, and there's a serious brain drain of Nigerian doctors moving towards the UK currently. The problem with psychiatry is there's a lot of stigma. What I mean stigmatization. Are you hearing me now? Okay, so the problem with psychiatry in particular in Nigeria is there's a stigma surrounding the practice of psychiatry. Stigma means people move away from psychiatry, they abet it, not only the people with the problem, but even the people who take care of people with mental illness. People associate abnormal behaviors of the people who are sick to even the practitioners, the people who take care of them. So for somebody to go to psychiatry, you have to take strides. It's not easy, you have to push yourself. Even people in the hospital, even other doctors, I think it doesn't make sense for somebody to be a psychiatrist, because you might end up, which is just a myth, developing a mental problem by working there, which is not true. It's not actually, it doesn't make sense. You don't become an animal because you're a veterinary doctor. But stigma surrounds psychiatry all over the world, but it's worse in some parts of the world, in places like Nigeria, and so many people are shying away. Your family, your friends, the people around will tell you, hey, why do you want to be a psychiatrist? Why are you joining those mad people? The loony house, the lunatic. It's not true. If we know that psychiatric disorders are very common, and the people with mental illness, they need help, just like everybody. And nobody is immune from this. So I think that there is need for us to realize that these facts on the ground and to encourage people to learn more about. Besides, psychiatry is the most human of all the medical specialties. Let me tell you, psychiatry is the only branch of medicine that doesn't have equivalent in veterinary medicine. That's the only one, because it's dealing with the human brain. And animals don't have the brain that has the capacity of us. But cardiology, you can have an animal cardiologist. You can have an animal gastroenterologist. That's a doctor who deals with heart problems with animals. But there is no brain doctor for animals. Psychiatry is the only human side of medicine.
In every 5 persons in Nigeria is suffering from one mental health issue or the other. 1 in every 5. Are we in a state of national emergency?
Well, anyway, you know, we
have to be very careful with the figures we have in this country. We don't have figures. We don't have facts for almost everything. According to the World Health Organization for this particular day, suicide prevention, that you have 1 million people killing themselves every year, and every 40 seconds somebody committing suicide. We don't know the figures for Nigeria. Even the one you caught is just an estimation. We don't have suicide figures in Nigeria. So it's just an estimation. But let me make it clear for you. When you talk about figures like this, you should remember mental illness is divided into 3, just like all other disease conditions. You have the most severe form of mental illness, and those are the people who need to be hospitalized and be admitted if they are very fortunate. Then you have the moderate type of mental illness and the mild type of mental illness. See, majority of the people who walk around the streets have the mild to moderate ones. The unfortunate ones who have the severest form, they are the ones those people see as clear with mental problems. But most of us, we carry it around us. See, this is life. You go to sleep, you wake up, you feel anxious. Sometimes you feel sad, you feel happy. All these things happen around us, and you operate of so many things. So many people have problems that are mild to moderate. It doesn't stop them from going to work. It doesn't stop them from going to school. But they do have problems, and they don't even know they have problems. And that's why they don't present themselves. So that's why it's more mild to moderate, and you hardly pick up the signs. That's why you have this figure. As much as 30 or 1 out of every 5 Nigerians having this problem. But we have to be very careful with the figures. We don't have figures in this country.
In Lagos State, the Federal Neuropsychiatric Hospital in Yaba you guys were on strike for a while. You just resumed a couple of weeks ago. We have just 200 doctors in Nigeria. We don't need you going on strike with the numbers that we have. What were the issues you had? Why did you go on that strike?
Okay, thank you. Yes, we understand the deficit on ground, and in fact, the number you mentioned, I'm sure that it's no longer that number. The rate people are moving out.
Right.
Yes. So the major issue why we had to down tools at that time was because of manpower shortage.
Okay.
The Federal Neuropsychiatric Hospital Yaba is the biggest mental health facility in Nigeria, with an average of about 535 bed spaces. Even though it's a mono-specialist hospital, so many people tend to look at it from the eyes of just one area, and then they tend to project it into a general teaching hospital where you have little departments. So they think, okay, it's just a small place, but it's a large hospital with a lot of patients. So on the average, within a week, we see up to about 1,000 patients in the clinic within a week, and all that is being done basically by 33 resident doctors. The structure of the medical specialist training is such that there are consultants who are the head of the team, and then there are resident doctors. There are junior resident doctors, junior registrars, and then there are senior registrars. So the registrars basically do they are like the ground troop,
Okay.
while the consultants are like the generals. So they command things, they direct things. So when you have just 33 resident doctors, you have to spread them around different units. So you have our activities basically involve seeing patients in clinic, reviewing patients on the ward. Each ward we have a ward we have about 30, about 35, between 30 and 40, depending on which ward. We have between 30 and 40 patients. So you could have maybe one person on the ward, on that ward, doing that work. So when you have that going on, what will happen is normally it should take you about 30 minutes to even 1 hour to review a patient on the ward. If you have 30 patients on that ward, you have to do that activity between 9 o'clock and 2 o'clock because you have clinical activities before, you have other activities within the hospital that you have to take care after. So you can project that and see how long it will take to see a patient.
That means they wouldn't be getting quality checkups.
How many people, yeah, exactly. So how many people will be seen. And when you get to clinic as well, if a clinic is going to have 200 patients, and that clinic is being run by, let's say, 4 resident doctors, and each resident doctor, normally the standard should be that in a clinic you should spend about 30 minutes seeing a patient. And so if there are 200 of that, of those patients, you multiply that by 30 minutes. You wonder how we get to do that.
That's not happening in the whole
exactly
day.
What we do more, we're doing more of sacrificing quality for speed because we had to finish. Because if you don't finish, the patients are going to yell at you, they are going to get angry, they are going to think that you are not
you are neglecting
nice to them. And you can think of the kind of environments where we are working, kind of people we are working with.
Right.
So they are not the kind of people you can explain, some of them are not the kind of people you can explain these things to. So you just have to sit down there. So there are times when clinics finish at 5 o'clock, 6 o'clock. In fact, there are times when even those consultants who shouldn't be doing too much of that, who should be seeing the maybe very serious issues that we cannot attend to, overseeing how things have to get into the whole work and just work like the ground.
But this is because we don't even have enough psychiatrists.
Yes, there are.
So how are we going to bridge this number gap?
So there are 2 issues. First of all, there is the general issue of very few people are interested in psychiatry. Very few doctors. We are like the exception. There's the general issue.
Dr. Aminu mentioned that there's even stigmatization for doctors.
Yes. Even some of our colleagues say that you begin to behave like so the patient after some time.
Wow.
We find very hilarious, although there is a lot of improvement in awareness now. But the other issue is even out of the pool of those who are interested, the number of people who are taken in is far less. So we have people who have written the exams to qualify to start their residency, their specialization program in psychiatry, and for a year, for 2 years, even for 3 years, I was aware of someone who traveled right around the country with that, having passed that exam for about 3 years, couldn't get a place in any of our centers.
Is this a peculiar situation? Because we need to actually clear that. Is this peculiar to psychiatrists alone, or in the medical profession in general?
I think it's a general problem.
Okay.
It's a general problem. There are people who have written exams, who have passed exams, and they are willing to start their specialization, but they are traveling around the country. They can't find.
But we have shortages. We need them in the system.
Yes. So that doesn't make too much meaning to us. So that's the situation that we're dealing with. So even though there is a general dearth in number of people who are interested, now of the pool of those who are interested, there is now, for whatever reasons, management are not employing enough people to fill in.
Has this changed since you went on that strike? You're back, but has anything changed?
Unfortunately, no.
Unfortunately.
Dr. Aminu, quickly, we need to go on a break, but just to add to what our guest in the studio, Dr. Aladejare, is saying, tell us about the population of psychiatrists at the Aminu Kano Teaching Hospital.
Well, I think Kano has a peculiar problem. You know, Kano is one of the most populous states in Nigeria. It's a projected population of almost 15 to 20 million as of currently now. But the Kano, the only place where you have specialist psychiatric services is in the teaching hospital, the only hospital. And I think we number around moves towards Kano for looking for healthcare services. So, yeah, and all the specialists, all of them are to be found only within the teaching hospital. yeah, we don't have the
Like,
federal neuropsychiatric hospitals, just like you have in Lagos and the teaching hospital, or Maiduguri, where they have a teaching hospital and a neuropsychiatric hospital at the same time. We only have a federal teaching hospital with American teaching hospital. It was just 44 bed spaces.
Yeah,
Can you imagine that? For population, yeah, for population of 15 million, and well, a very few state-run psychiatric hospitals owned by the state government. But the only place in Kano where you have the formal psychiatric services, oxy that's been practiced by professionals is within the teaching hospital.
We must go on a break now. Thank you so much, Dr. Aminu Shehu Ibrahim. He's a mental health specialist, Department of Psychiatry, Aminu Kano Teaching Hospital. He's joined us live from Kano. Alarming statistics there, just pretty alarming.
It's disturbing.
Very, very disturbing. Thank you so much for joining us on the show today, sir.
Thank you.
Oladejare Samuel, who is the General Secretary, Resident Doctors Association at the Federal Neuropsychiatric Hospital in Yaba, Lagos. We'll be going over also to Port Harcourt, where we'll be speaking with Dr. Ruth Onyebuchi Phillips, who's a Senior Registrar at the Department of Neuropsychiatry at the University of Port Harcourt Teaching Hospital. And we can look at the statistics there also. It's pretty alarming. We'll be back shortly. I am Wemimo Adewuni.
And I am Sheriff Quadry.
on your number one talk news and sports station. This is the Morning Crossfire with Wemimo and Sheriff.
We are back from the break. It's World Mental Health Day, and alarming statistics we got from Kano. We spoke with Dr. Aminu Shehu Ibrahim, who's a mental health specialist at the Department of Psychiatry, Aminu Kano Teaching Hospital, where they have between 17 to 18 specialists and 44 bed spaces in a state with about 19 million people, and people coming also from neighboring states to get treatment in that hospital. 44 bed spaces. Pretty alarming. Here in Lagos, about over 500 bed spaces, but with a limited number of doctors working, yet we're not employing
33.
33 doctors. I mean, this is just so alarming. But we're moving over to Port Harcourt to find out what's going on there too. We have Dr. Ruth Onyebuchi Phillips, who's a senior registrar, Department of Neuropsychiatry, University of Port Harcourt Teaching Hospital, joining us also over the phone, and you can also watch her over Facebook and YouTube. Good morning, Dr. Ruth. Thanks for joining.
Good morning. It's a pleasure to be here.
This conversation. Let's talk about the human rights of patients who have mental challenges. They also have rights, and these rights are also covered just like the rights that every other Nigerian has in terms of accessing health care. Do you think that with the challenges we've had, I mean, we've gone to Kano, back here in Lagos, we have limited resources, are these rights protected with the limited resources that we currently can access?
Well, the rights they have, I will say that they're actually still restricted in terms of those rights, because part of the rights they should have is the right to be free, the right to actually wear their own clothes, have their own corners, even while they are in the hospital and being treated, even the right to even refuse treatment if they don't want. The right should even extend to the part that they can decide that they want treatments at home, but unfortunately, we do not have policies in our country to support those kind of rights.
Where we were on break with Dr. Alade Jare here in the studio. He's a psychiatrist as well. And we're talking about, why do psychiatrists leave? Why? Why do they leave? Because we have
why do they
shortage,
leave?
200 psychiatrists, which we are hearing that it has dropped right now. But let's just work with the number 200 psychiatrists for about 200 million Nigerians. That's 1 to 1 million Nigerians, and the number has continued to drop. The last time we had the conversation, it was 250 psychiatrists, and that was just in June or thereabouts.
Right.
And now it's 200, and it keeps dropping. Why are psychiatrists leaving Nigeria?
Okay, so with respect to that question, I don't know if it's specific for psychiatrists. I think it's generally doctors leaving Nigeria. So there are so many reasons people are leaving Nigeria, and that will include an advancement in their careers. So if you think that you're going to get better training, better learning, there's so many things that we see in the textbook that we barely see in our country, or things that we do not have access to right now in the country. There's so many other services that we know about that exist, but we do not have those services present in the country. Take, for example, what they call the crisis team. That is usually done in the United Kingdom. We don't have that service currently in the country. So we have emergency services, but we do not have services that are going to extend to treat patients in their community. It's not as developed as it is. I know centers like Neuropsychiatric Hospital, Abeokuta, Aro, they actually have the community psychiatry where they try to interface with the people in the communities to actually treat them. But it's not so developed in other centers. And those are things that should be in place. I mean, if a patient, like you talked about their rights earlier, if a patient doesn't want to come to the hospital to gain treatment and you can go to them, they should actually get the treatment at home if they have to, because that will also mean that it's going to reduce the stigma that people are afraid of. And so if they get the treatment in the house, or you get a crisis call that someone is trying to attempt suicide or someone is suicidal and you can reach them at home, I mean, you can go to their houses and treat them. So I'm sure people are going to advance their careers and learn better probably to come back to Nigeria and implement this thing. So
In the
it's not
2020
totally such a bad idea.
budget, 46 billion naira was allocated to the health ministry. The president just presented the budget recently on the 8th of October. Financing mental health services, according to WHO, about 3.3% of the health budget of the government goes to mental health. With over 90% of this going to mental hospitals as at 2019. According to WHO, also the new National Health Insurance Scheme provides short-term coverage for affective mental disorders. Is this true? Let's bring it down to the hospitals. Mental disorders, are they covered by NHIS? And do you believe that we have enough funding for mental health care?
Well, this is news to me because it's not something that it's practical. We don't even have mental health drugs in the NHIS scheme. You will not be able to access it. So if the medications are not even subsidized for patients to actually have these drugs, there are newer medications coming up every day, but they are so expensive for people to actually buy them. So if you can subsidize medications or maybe reduce the tax that the companies have to pay in order to bring these medications into the country so that patients can have access to them, then I don't even really know where the budget is going to. Not to talk about the infrastructures for patients that require mental services. Canada just told you they have 44 beds. In UPTH, we have barely 50 beds for the Port Harcourt population, which is more than what we have in Kano. We have more than 2 million persons in Port Harcourt or River State. So imagine that you have 2 neuropsychiatric hospitals, 1 federal and 1 state in the whole of Port Harcourt. What will happen to those people that have mental illnesses in the communities? The WHO has made a plan, which is called the mental health gap, in order to bridge services, to reduce the timing in which people can have access to people that have mental health problems. So they're trying to bridge that gap so that you can get services even in your primary healthcare centers. And there are several primary healthcare centers. So if you have people that are not necessarily psychiatrists, but trained professionals to take care of mental health problems in those communities, it means that these illnesses, these mental disorders can be identified in time. They've even made a template, like a protocol on how to go about identifying this. So all they need is training. But then, do we have the commitment from the government? Do we have commitment?
And the number of bed spaces that you have. But I would like to know, how many healthcare providers, psychiatrists do you have?
Currently, we have about 8 consultants in the department, and we have over 12 to 15 residents. So a total of 23 residents, yes, senior and junior residents. So we in a day in the clinic, you can see more than 50 patients in a day, 50 to 70. Yes, not to talk about emergency services and other liaison services. So
cost of treatment you mentioned earlier. A lot of people keep their loved ones at home for fear of being stigmatized when they can actually have access to treatment if they had gone to our health facilities out there. Maybe this is me being very optimistic, but how would you say the cost of treatment is affecting? What would you say to that the cost of treatment, it could be one of the reasons why people don't go for treatment in health facilities? What is the cost of treatment like, really, basically?
Well, I will beg to differ that it's not entirely true that the cost of treatment is one of the reasons people don't go. I think the problem we have in our environment is that when we hear about mental illnesses, we tend to do religion more than medical. So people will rather go to a church and pray for and pay money over 200 of thousands, 500 of thousands for them to pray for their people or their person to actually be cured of the demon that's causing the mental illness than actually pay for a mental health service. So not at all. They're just some kind of dysregulations of the chemicals that are in the brain. So those, most of the time, that's what causes, and then other environmental factors, and then sometimes genetic predispositions. So the fact that they don't understand that it's actually a medical problem is one of the drawbacks that we have. So they're unable to recognize that it's a medical problem. If you have someone that has a stroke they will quickly, in fact, stroke is another one that is, but right now, a lot of people know that, okay, stroke is something that can be treated in the hospital. And then they will come quickly if the person has a stroke. But when it comes to mental illness, they're just going to tell you that they're going to church first. Even the ones that come to the hospital will rather go to the church still and tell you that they want to take their person to church and go and pray first before they come back to the hospital. And half the time you can see them. So because they have the right to actually go home if they have to, you let them take their persons. So I don't think that the cost is totally it. In as much as there are people that are indigent that actually need it to be subsidized and actually maybe get into the health insurance scheme and get access. I don't think cost is totally the problem. But when it comes to medications, knowing that it's a chronic thing and it's something that is going to be, they have to take for a long time, that's where cost comes in. But when it comes for them to actually assess treatment, I don't think that assessing treatment in the initial time is what the cost is the problem. I don't think so, because all you have to do is in the hospital system, get the folder and pay for your consultation. Half the time you won't spend more than 2,000 naira, 2,500 to get
in
access.
Lagos here, we have quite a number of private homes, actually for people who have drug abuse issues and then need to see a psychiatrist. We have a number of care homes. I was trying to get a care home for someone, and I made a number of calls. I just went online, looked for these people, and for some of them, just to come and register and go through that care process, you need to come with 1.6 million naira. I mean, I went like, for how many people?
Excuse me.
For 1.6 million naira. However, when I asked at the Federal Neuropsychiatric Hospital at Aro, I mean, for admission and everything was 80,000 naira. For this family, unfortunately, it took them a while to be able to get 80,000 naira. So we still have, like Dr. Ruth has said, some people who cannot really afford, they need the help. Some of them know where to go to, but they just can't help it. How do we cater to this group of people?
Thank you very much. The cost of let me start with the cost here in Lagos.
Yes.
The cost of an outpatient treatment, that is, you come that day, you leave that day, you are not being admitted,
okay,
and you just get your medications. You would spend relatively about 10,000 naira in Federal Neuropsychiatric Hospital.
That isn't per visit?
For your first visit, because
Okay.
you're going to pay for a folder which currently is 4,000 naira. You're going to pay for a folder which currently is 4,000 naira. Then you're going to buy medications. You may be asked to do one or two other investigations aside the investigation included in your initial payment.
Right.
So with 10,000 naira, you should be able to pay for your first visit, as well as obtain medications for at least about 2 weeks. Now, there are different medications, and which is where the issue is. There are medications which could help the patient, but there are side effects to them, side effects that are not too palatable. So there are newer medications, and those newer medications are the ones that cost more. And so whenever you see indigent patients, what we do, first of all, is we try to prescribe more. We can't use those newer medications because by the time you give it to them, they manage to buy the first one,
They
and
can't
then they can't continue with they need to take these medications for
regularly,
relatively long time, so they can't continue with that. So, and then if it's going to be admission would cost about 100,000 naira. So by the time you have to buy the materials you use on the ward and the rest of it, so you eventually spend about 120,000 naira, which is the initial cost for about a month. After which you might have to start making additional deposits for psychological investigations, other biological investigations, and medications. But as much as possible, the hospital has a policy of not driving away people that really require care.
Okay.
So even if they find it difficult, getting that money initially, and they really need that care, the hospital has found a way to make them pay somehow. Call people here and there, and within the hospital there are groups that there are people who have they are good Samaritans who have donated to some funds that may be available for people who really need it.
NGOs and some individuals.
Yes. Very few though. The fund is limited. But I think a better way of approaching this would have been to include it as part of the NHIS.
Right.
Even though you said it's included, but I'm not aware of That's for it to start with. The medications are not even on the drug schedule, so there is no way to even prescribe anything on it. So if you include it there, it could help to for more people to be able to afford it. And we have a peculiar situation in that these drugs, the treatment many times will take a longer time than other types of illnesses, whereby you take a medication for 2 weeks and you are fine, you don't need to continue with the medications. In our case, many times you need to take drugs for 3 months, sometimes even up to 6 months, 1 year, or even more. So
depending on the case.
So if the person is not one that can do the kind of work that can even produce that kind of money, it's going to be a problem.
That's a big problem. The phone lines are buzzing. Let's head over there very quickly. We have in the studio with us Dr. Aladejare Samuel, who's the General Secretary, Resident Doctors Association at the Federal Neuropsychiatric Hospital, Yaba, Lagos. And also on the line, we have Dr. Ruth Onyebuchi Phillips, Senior Registrar, Department of Neuropsychiatry, University of Port Harcourt Teaching Hospital. She's also live with us on Facebook and YouTube. If you need to reach us right now, here are the numbers.
Call us on 01-277-0993, 01-277-1993, 01-277-2993, and 01-277-3993. This is Nigeria Info. We are listening.
Yes, this is Nigeria Info. We are listening. We need you to keep your comments as brief as possible.
Please
so we can take as many as possible. Please. Thank you.
Ade is here from Ejigbo. Ade, good morning to you.
Hello, good morning.
Good morning.
Yeah. The issue of psychiatry in Nigeria, right?
That's right.
This issue is a very big issue. There's a woman I know at Yaba. I think if I mention the name, your guests from Yaba will know this woman very well. For over 6 or 7 years now, this woman has relocated to US. Before this woman relocated to US, if you see this woman, he has been complaining about this since. But today, if you see this woman, it's a very... is doing well. Even published some book from US. So when you bring it to Nigeria, you see this book about the situation of health in Nigeria and compare to the US.
She's a doctor, I guess.
Yeah, she's a doctor from Yaba Psychiatric Hospital there.
And now she's doing better that she has left the country.
I'm telling you now. I'm telling you.
Thank you so much.
By 2 years later, he came and picked his husband and his 4 kids.
Wow.
All of them have relocated to US now.
All right, Ade. Thank you.
Thank you for that. On Twitter, we have a comment from Joy Forever who says, not enough facilities for mental health challenged people. Reasons many take to spiritual and herbal homes for solutions. Depression is becoming a major factor now.
Femi, good morning to you.
Good morning, sir.
Good morning.
Good morning to the guest in the studio.
Morning.
Yeah. I have, and I think I have.
We can barely hear you, Femi. What did you say?
I want you guys to talk about MPD, multi-personality disorder.
Okay.
Please. And I always have mood swing all the time. Sometimes I'm going to be happy. Sometimes I'm going to be very angry. And I want to ask, though, addiction, is there anything like a good addiction? Because I think I'm addicted to some things that actually makes me happy. Not substance, though, like when I'm always on my laptop, movies, you know.
With the way you sound, I think you need to talk to a doctor, Femi. I would seriously recommend that. We can't do
because of time.
Yeah, we can't do treatment on air because cases are peculiar.
Right.
I'll advise you head over to Yaba and see a doctor, right? Let's do that.
Chukwebuka, good morning to you. Hello, Chukwebuka, can you hear us?
Good morning, Wemimo and Benga.
Good morning.
Good morning.
Benga Ke.
Sorry.
Good morning.
Morning, Chukwebuka.
Wow, Sherry. Good morning to your guest in the studio.
Good morning.
My name is Chukwebuka, calling from Shomolu. Just like one of the callers said, I think I once had 2 friends as in doctors in the psychiatric who also left the country for greener pastures. I mean, when you see them now, you not believe it. Then, I think the government has a lot to do. I think the welfare of our doctors, especially in this psychiatric aspect, has to be looked into properly. They should be encouraged. I must tell you, it's not as if the government should do everything for them, but they should look into their own side and complaints and everything.
Right.
Look at the last time they were on strike. You can imagine when psychiatric doctors go on strike.
Right.
What do you expect, for heaven's sake? And then, if you look at the country today, there's a lot of depression, leading to this suicide and what not. You understand? So I think these doctors should be well taken care of, so that people who are depressed, people who are presently in that hospital, and should be taken care of all over the federation.
Thank you so much, Chukwuebuka. You made a fantastic point there.
Ogochukwu is calling from Festac. Ogo, good morning to you.
Hi, good morning, guys. Good morning. Interesting topic this morning.
Thank you.
Thank you to the doctors, everybody that has spoken. I was actually listening to hear a mentioning of psychologists, like clinical counseling.
Right.
Hello, Ogo. People can actually help to detect these things before it gets to the consultant, because that could also cut down on the overwhelming of the consultant.
Right.
All right.
Thank you so much, Dr. Ladejare. Two things: clinical psychologists that could help reduce, and then for people who have issues around suicide. I mean, I've heard that people who have attempted suicide once are prone to attempting.
Want to try it again?
So let's talk about suicide and then getting treatment from psychologists.
All right. Okay, so mental health treatment is a teamwork. It's a teamwork, very much like every area of medicine, and psychologists are very relevant to the treatment, to the management of mental health patients. Yes, psychologists are areas of competencies are different. Now, first of all, for the primary health system, part of what the Dr. Ruth in Port Harcourt mentioned was about the image gap system. An image gap system is a system whereby the regular workers at the primary health center can detect simple mental health issues. Even treats, because there's a guideline, there's a manual they are supposed to follow. So if they follow that manual, they are supposed to treat the simple issues and only refer the serious issues. So if that system worked, we wouldn't have, in fact, in the saner climes we talk about, UK, US, they are more of facing out the big centers. So they are now in the phase whereby they are focusing more on the community center. So they are having less of these big hospitals, big psychiatry hospitals. So they are now having smaller centers in each place. So those people are meant to make sure that only the very serious issues get to the teaching hospitals.
Let me go to Dr. Ruth on the suicide, because we're running out of time. Dr. Ruth, for someone who feels like committing suicide, some of them might be listening right now, what can they do?
Okay, so if you're having thoughts of suicide, I just want to tell you that there's hope for you. All you have to do is reach out to someone or go to the nearest hospital and talk to someone, because those thoughts you're having are not really the best of thoughts at that time, and that you can get help for whatever the problem is for you at that time. So once you get to the hospital, you're going to get referred to a psychiatrist. Do not frown at it. Just go talk to them. Talk to a psychologist, talk to anyone at home and tell them that you need help, or they should refer you to the best place you can go. I'm sure there are health facilities around you that you can get help. So if you're out there, there's hope for you. Suicide is not the answer. There's hope for
conversation. We thank you very much, Dr. Ruth Onyebuchi Phillips. She's a senior registrar, Department of Neuropsychiatry at the University of Port Harcourt Teaching Hospital. Thank you so much for joining the show.
Thank you.
Resident Doctor Association at the Federal Neuropsychiatric Hospital, Yaba, Lagos. Thank you so much for your time.
You're welcome.
And big thanks also to Dr. Aminu Shehu Ibrahim, mental health specialist from the Department of Psychiatry, Aminu Kano Teaching Hospital in Kano, who joined us earlier. Our correspondent may be in Kano, and Emmanuel Owuka made this happen. Big thanks to you also, and thanks to Tosin Akinrede, Yvonne Okafor, and Zainab Yakin. Also to Tunde Abdusalam and Sherry Flowell. Joy Kalio also packaged that report that we opened the show with earlier on from our newsroom. Thank you all. We'll see you again tomorrow morning. Suicide is not the way to go. Please get help. Help is available. I'm Wemimo Adewuni.
And I am Sheriff Quadry. Do have a great day.